I think we're live now. Are we on Facebook Live?
Yes.
Perfect.
Okay. I'm going to share on mine.
Are you going to share the slides on your end?
No, you share. Go ahead. Okay. Squinapoi, Ayuqui, Nakna, Virginia Hedrick, Shregon, Mewamechuk, Nek Pulik Law. Hi, everyone. This is Virginia. I'm joined today by my staff and colleague, Wyatt Kelly, and I wanted to give Wyatt an opportunity to introduce himself.
So hello, everyone. My name is Wyatt Kelly. I am White Mountain Apache from my mom's side. I'm the public health coordinator here at CCUIH. I'm here in Sacramento right now. It is super sunny, and I'm happy to be here on Sunday talking about COVID-19 and variants with you all. So happy to be here.
So we just wanted to, and it's been a while since I've done a live for folks. Many people know that I've been sort of updating, doing COVID-19 lives. Why it shows that we are, there we go. Been doing updates on COVID-19, and we're going to talk about some data today. We're going to talk about where we're at with variants. We're going to leave out some data, and we'll talk about like where we're at with vaccinations, and we're doing really great in Indian country, that we can do better though. So we're not going to share all that data, but we can do that later in another post. We just kind of wanted to focus on where we're at. I want to share today, I'm in Kenneck, the village of Kenneck in Tule Creek, California. So I'm not calling in from Sacramento, and just really happy to be here with you all today. So we'll go to the first slide, Wyatt. First, I wanted to start with this slide. The organization for which Wyatt and I work for is the California Consortium for Urban Indian Health. And we have launched a 1-800 number. It's called the Cal Hope Red Line, and it's really a peer support line. It's open Monday through Friday, 8 a.m. to 7 p.m. Pacific time. You can call 1-888-368-4090 or text 916-252-5002. And I started with this slide intentionally, actually, as we were building some of this data. I felt like it's not all good news. So maybe that's the spoiler alert, is it's not all good news. And I feel like many of us, myself included, have really been experiencing pandemic fatigue. And we're really ready for things to go back to normal, quote unquote, like whatever that new normal looks like. And some of the information we're going to share today, it may make folks feel stressed and feel overwhelmed with where we're at, or that we're going backwards, and we'll talk about that. But I want folks to take a note of this, screenshot this, because you can call this line and just say like, oh man, I'm really angry, or I'm upset about where we're at and just need somebody to vent to. Maybe your normal venting places aren't available, or they're sort of tired of hearing it. And I just wanted to share this resource about the red line first and foremost on upfront. And there'll be some good news too, but we wanted to start here. So we can go to the next slide. So on a whole in the US, we have documented more than 34 million cases of COVID-19 and over 600,000 deaths. I always take a pause when we report deaths, because I know for the families and communities who have lost people, it is not just a number on a ticking score or on a data chart. That communities have been deeply, deeply impacted by these losses, and we've lost some really key people in our communities. And I always want to share that my heart goes out, and continued prayers for families impacted by COVID-19 and folks who have lost loved ones due to this virus. Next slide. So you've been seeing me share these sort of wave, these data charts that show where we're at in waves. And last year we were talking a lot about waves and like when the first wave of the pandemic would be. And I wanted to walk you through it. So I want to draw your attention to where we started. When we started in January 2020, where some early murmurs of rumors of COVID-19, that there was this virus, and it was sounding a lot like SARS, and it was sounding a lot like MERS, two other COVID viruses that hit the United States in the last 20 years that sort of just hit the radar and then came off. Like they didn't hit pandemic level. And then by March 2020, most of the United States was in a full shutdown. Schools had closed. We were taking very extreme measures, and we were at less than 100 cases in California at that time when that happened. By the time we got into April of 2020, we saw case rises, and we said we're in the first wave. And I actually argued that we were not in a second wave when we were in June, that we were still riding the first wave. And you can see that actually some part of that is true, that what came in June 2020 was a second wave. Some might argue that we never actually got to a low point, that we just sort of steadied for a minute and then went higher. And then where we really surged out of control was in the winter of 2020 and January 2021. And that really kicked off that really large second wave, third wave, some might call it, kicked off right around Halloween. And the single most important intervention that happened during this time was the introduction of vaccines. Vaccines were approved within the first week of December and made available to Indian country the week before Christmas and the week of Christmas. And we start to see a sudden drop off in numbers, a very steep decline in numbers after the introduction of the vaccine. So that's what happens in January 2020. Nothing else changed at that time. I really want to emphasize this point. Nothing else changed. We were still had social distancing measures in place. Schools were still closed. We were still hand washing. We were still universal mask wearing. The only thing that happened in the winter of 2020 and 2021 was the introduction of the vaccine. That shows absolutely, unequivocally how effective vaccines are. And we saw a huge uptick in vaccines. And then we start just downward trending, right? We see numbers downward trend. Now here we are in June 2021, and we're still talking about COVID-19, and we're talking about the Delta variant and how variants may be acting differently. And we're upward, the numbers are trending upwards. So we are not out of the pandemic. It's not over. We're not just returning to normal. In fact, Wyatt and I were looking at these exact numbers. So what you see, the red line here, is a 7-day average. And why we do a 7-day average when we talk about COVID-19 data is it gives us a chance to sort of level the playing field on data reporting. Some county data comes in a few days late. And so when we look at changes day to day, there could be a lot of things that happen. Maybe a certain lab just reported a bunch of data over the weekend. And so day to day is not our perfect measure, but the 7-day average is a really good measure. And we are really close to where we were just a few thousand cases away from our numbers in June 2020. And we're in many ways reopened. And I'm here on the reservation. I'm traveling. I'm fully vaccinated, so I'm in a different place than I was last summer. There are some things that are different, but the numbers are not that different. I took a look at some of the data coming out of the California Department of Public Health, and they're reporting that 99% of new COVID cases are among unvaccinated individuals. So we'll talk more about the importance of vaccines, but I wanted to just kind of show where we're at in the US, and we can go to the next slide. This slide looks eerily similar, and the only thing different to tell you about this slide is this is California. So California followed the trend line of the United States very closely. The disparity between where we were at, like the difference, the negative difference between where we were at in June 2020 and where we're at July 2021 is we're doing a little better here in California than we are when we look at the full United States. And we've had really great vaccination numbers here in California. We're approaching, I think, close to 70% vaccinated individuals. Does that sound right, Wyatt?
Yeah, it's about 72, I think.
Okay. Yeah, so we are we have a large population of folks here in California that are vaccinated. And so we're getting close to July 2020 numbers, but we're doing a lot better. We're about half of where we were at last year. So that's good, but we are still seeing that small trend upwards in July. We can go to the next slide. Another way to look at the data is to say, we just want to look at what's happening in the last 7 days. So, sometimes when we say, well, there's been 34 million cases of COVID, the vast majority of those are people who have recovered from COVID, are past their infectious window. So we wanted an opportunity to show you what's happened in the last 7 days exactly in raw numbers. So Texas has reported the most cases of all states in the United States at 31,000 cases of COVID in the last 7 days. California has reported the second highest number of COVID cases at 27,000. And then we go on to Louisiana at 16,000. It just kind of keeps going down. There's another way that we could display this data, and we decided I didn't want to overwhelm folks with data. The other way to do this would be to look at it per 100,000, and that would take into account more rural and more urban states. And so it is true that Texas and California are among the largest states in the United States in terms of population size. So it makes sense that we're reporting higher numbers than other states. But this is just to give you the raw numbers that there are 27,000 reported active cases of COVID-19 in California in the last 7 days. We can go. The other way I wanted to tell you how COVID-19 is looking like in Indian country is exactly how it is looking for those who are identified as American Indian Alaska Native when they're testing. The snapshot that I'm showing you here is actually a really short window. We're looking at June 27th, 2021 to July 18th, 2021. So about a 3.5, 4 week window of time here of reported cases of COVID-19. And here we see that we're only looking at cases here. This is not deaths. Don't be distracted by the death pieces. This is only cases. It is adjusted per 100,000. And you see that non-Hispanic American Indian Alaska Natives are still the highest number of COVID-19 cases. So this problem of COVID-19, it's not gone. It's not gone in Indian country. We've had more than 1 million people vaccinated throughout the Indian healthcare delivery system. And that's at federal IHS, that's at tribal health programs and urban Indian health programs. And yet we still rank among the highest COVID-19 cases. This is kind of where I was saying, like, it's not all good news. We've done a really great job in Indian country in getting information out and getting folks vaccinated. But the numbers still show that we are disproportionately impacted by this virus. It still remains a threat to our communities. It remains a threat to those who are not vaccinated and those not eligible to be vaccinated. And we'll talk about what that susceptible population looks like. We can go to the next slide. So one thing I want to be really clear about is vaccines are available for any individual 12 and older. So it is 12 and older. I've given plenty of Facebook Lives where I'm talking about 18 and older and then 16 and up, but we are absolutely at 12 and older. We can go to the next slide and I'll tell you which vaccine is available for 12 and up. The Pfizer vaccine is a 2-dose vaccine. It's to be taken 3 weeks apart, and it is has been FDA approved, emergency use authorized for those 12 and above. You heard a lot of conversation from me about Pfizer and its availability very early on in its original rollout in December. The vast majority of Indian health care programs in California did not have access to Pfizer because it required ultra cold storage. It still requires ultra cold storage, but Pfizer has made some adjustments to how it can be stored, and more Indian health programs now have access to Pfizer. And a lot of other county systems have access to Pfizer as well. So if you have children in your home that are 12 and up and you feel like maybe you don't have access to Pfizer, please reach out to us. If you call the red line, they will absolutely help you find a location that has the Pfizer available. The second vaccine that's available to folks is Moderna. I personally have been vaccinated with Moderna. It's a 2-dose vaccine taken 4 weeks apart, and anyone 18 and up is eligible to take Moderna. Then the third vaccine we have available is Johnson & Johnson. It's really great for folks who are afraid of needles or don't think they're going to be in the same spot for a follow-up. It's a 1-dose vaccine, and it's available for those 18 and up. Another key piece in this is this last line on this slide, but you are not considered fully vaccinated until 2 weeks after your final dose. You do get some protection from one dose if you've taken just one dose of a two-dose vaccine, but you're not considered fully vaccinated until after 14 days after your second dose. That's when your body has had a chance to fully absorb the vaccine, where that messenger RNA has made it through your immune system, sent all the right messages to all the places that your body is going to be at peak immunity and ready to combat any introduction of COVID-19. There are individuals who are getting infected with COVID-19 either in between doses or before they're have completed their fully vaccinated status. And so I'm seeing a lot in social media and other places where folks are saying they got it even though they were vaccinated. And when you dive a little deeper, about half of those cases I'm seeing actually got COVID before they were fully vaccinated, or had asymptomatic, meaning they were not symptomatic COVID at all, and they were able to get their vaccine. So they actually had it before they were ever vaccinated. So that's not to like push back on it. You can still get COVID if you've been vaccinated. The vaccines are extremely effective in reducing severe disease, so reducing hospitalization or death to COVID-19. It is possible. It is a rare event. Somewhere between under less than 3% of folks who have been vaccinated would get COVID-19. And we'll talk a little bit about what the variants look like. Wyatt, is there anything you would add here about these vaccines?
I just would highlight that last line again, just how important it is to make sure that it's after your final dose, because I actually had a really good friend here in Sacramento who had their first dose, and they thought like, oh, I could kind of like start to loosen up because I'm in the process of getting my vaccine. And then he ended up getting COVID after his first dose, like a week after his first dose, and got it really bad actually. So I think just stressing how important it is to make sure and wait until you're fully vaccinated to really even loosen up a little bit about things.
That's a great point. Thank you, Wyatt, for sharing that. So by now, unless you have turned off the news, which I am absolutely guilty of, you have likely heard about the Delta variant. And I actually brought on Dr. Sophie Nooner just a few months ago to talk about variants, because we were tracking variants then. And we've been talking about actually since the beginning of the pandemic that there would be variants. This is how viruses work. All viruses mutate. It's just what they do. And sometimes a mutation starts to bubble up and it's not really effective in what it's doing, and it kind of falls off the radar. California and the CDC tracks known variants and then what they call variants of concern. So there are probably more than 100 variants of COVID-19 that we will never hear about, that you don't hear about. And then there are a few that you do hear about. You hear about the alpha strain, the dominant strain, the delta, and then there's a few others that you can go in and kind of like see what their names are. So we can go to the next slide and I'll show you what that is. So what is a variant? I'm going to read this just so it's super clear for everyone. I don't really like reading from slides. You all know that. But it's important to know that viruses constantly change through mutations that create new strains of a virus. A new strain of a virus is called a variant, and this naturally happens over time. Some virus variants emerge and then disappear, while others persist and become common. Most variants never have a meaningful impact. Public health becomes concerned about a SARS-CoV-2 or COVID-19 variant when it affects COVID-19 transmission, severity, testing, treatment, or vaccine effectiveness. So that's when a vaccine falls on the chart as a variant of concern. So if we see that a variant is showing to be more contagious, that might be a reason that it becomes a variant of concern. If we see that a variant is not being detected in testing, then it becomes a variant of concern. If we see that folks who who test positive for COVID-19 and the normal treatments aren't effective, then we see that that becomes a variant of concern. If we see that lots of people are getting COVID-19 who have been fully vaccinated, that becomes a variant of concern. And all of these are measures that are tracked globally by the United States and by state level and at county level and at tribal levels. and within the Indian healthcare delivery system, would we be tracking all of these pieces? So when I say there's hundreds of variants of COVID-19, there's 100 that don't rise to the level of concern. They're behaving just like the dominant strain. Everything that we do to combat them, everything that we do to treat them, they're reacting the same way. There are a few that are behaving a little differently. And so we'll talk about what those are. Okay, so B variant alpha. So I mentioned alpha was one you might know about. It is in record as B.1.1.7, is associated with approximately 50% increased transmission and likely increase with disease severity and death. So the likely is we're still studying that part to see like how many people with the alpha variant are hospitalized and how many people with the alpha variant end up it being a fatal case. What we do know, what the data does show us, is that it's increased with about 50% transmission. So it's more contagious. That's what transmission means, is how contagious is it? Like we know typically with COVID-19, you really need to be around somebody within 6 feet for about 15 minutes or longer for you to really get COVID-19. So what we're seeing there is you don't really typically get COVID just by walking by somebody in a grocery store, but you would and could get it necessarily if you stood there and visited them unmasked for 15 to 20 minutes. Then your risk of getting COVID increases. Second variant to look at is the beta variant. It's noted as B.1.351, also associated with 50% increased transmission, and it may moderately have a decreased response to antibody treatments. The fact that variants are more transmittable, that they're more contagious, is what we expect in a variant. A variant is a living organism, and its entire goal is to keep surviving. There are viruses that are extremely deadly, and if you get it, or if a person gets it, their likelihood of fatality, their likelihood of losing their life to that virus is very high. Those viruses don't transmit very well, and sounds so cold, I know. They don't transmit very well because they kill the host. So a virus's goal is to be more contagious so it can stay alive. So it's not a surprise that we see a virus be more transmittable. We can go to the next one. P.1, the gamma variant, may moderately have decreased response to some antibody treatments, but we don't see reported higher levels of transmission. The one we're going to spend most of the time talking about today and what folks are hearing the most about is the Delta variant, and that's B.1.617.2, known as the Delta variant. The Delta variant was first detected in India, and was really one of the main causes of the extreme surge in cases in India. So the Delta variants are associated with increased transmission, may moderately have decreased response to antibody treatments. There are 2 sublineages of the Delta that are all compiling. They're all considered Delta. We're seeing some new emerging data on Delta that it may be more transmittable among our young people. Children have fared pretty well with COVID-19. They have not been great hosts of it, meaning even children who got COVID weren't really spreading it to adult household members. Most children who have gotten COVID have gotten it from an adult. The Delta variant is not behaving that way, actually. We're seeing that the Delta variant, children are getting sick from it. They are being symptomatic, and they are spreading it then to other folks. And they weren't doing that with their original strain of COVID. Why I want to stop here because I know you've been diving into some research on the Delta variant as well. What else would you add about what we know about the Delta variant?
I would just say that the Delta variant is the most common variant we're seeing. Like everyone who's getting sick with Corona right now, it tends to be the Delta variant. I think I read it's about I think it was somewhere between 75 and 85% of the COVID cases right now that we're seeing are actually Delta variant. So that's good to know that, it's this specific variant that's really spreading around right now. So if you know how to protect yourself and you know what you're doing and know how this variant spreads, who it spreads through, like the chance of you getting it is less likely. So just remember to stay safe. Remember that still going around, and that this is a variant that is, very, very popular right now. Over 80% of cases make up for this variant. So just try and continue to protect yourself and protect the community, protect your elders.
Thank you, Wyatt. And I think you raised some really great points. The Delta variant is still COVID-19. So all of the things that we've been doing to protect ourselves against COVID-19 will also protect us against the Delta variant. But we have seen, and we've all done it, right? We've all sort of loosened up. I shouldn't say we all. Many of us have loosened up on our COVID-19 protection strategies, including travel, vacation, visiting friends and family, sharing space with other households, because we feel we're vaccinated. We feel a little bit safer. I've created sort of like vaccinated bubbles around my children where I feel like we're hanging out with other parents who are vaccinated, my parents, things like that. And then we have mixed groups of unvaccinated and vaccinated, and that's kind of one of the areas that we're seeing the Delta variant is really taking advantage of those spaces as well. So we can go to the next slide. This is a lot to see, particularly if you're looking on a mobile device. So I apologize. I really debated putting this slide on here, but even if you are looking at it on a small screen, what I want you to know is that dark orange color is the Delta variant. And so this is showing like week by week, like it's about a 2-week indicator here, how many of the cases documented were Delta, how many were Alpha, how many were Gamma, beta, epsilon, all of the variants. So if you're looking at this on a small screen, I want your eyes to draw into the dark orange. And if you look at it left to right, on the left, we're looking at the week of April 24th. The Delta variant is not even notable. It's just a little tiny sliver in there. It's not the darkest orange. It's the second to darkest orange. It's not that red orange. And then just watch it grow. Maybe, I don't know why, if you can do a laser pointer, but you could kind of walk people through. Yep, exactly there. So there it is in a small sliver. By May 8th, we're seeing it's more notable. May 22nd, we finally see it on a bar. June 5th, it's taking some space. June 19th, it's like, okay, now we're coming up there. We're getting close to the Alpha variant. And then July 3rd, it's the majority of COVID cases are noted to the Delta variant. And then by July 17th, the vast majority of people testing positive with COVID-19 are testing positive with the Delta variant. If you have COVID, you should assume you have the Delta variant, and you should assume that it's going to behave differently. So we have, all along the pandemic, one of the biggest threats to COVID-19, aside from COVID-19 itself, has been misinformation and combating misinformation. And so we have had people say, oh, kids can't get it. Kids can't get COVID-19. And while kids, like I said, we would say, really from a public health perspective, we would say kids have fared pretty well with COVID-19. The same is not true for Delta. Delta kids are getting sick, they are becoming symptomatic, and they are transmitting it. This is why the pandemic has, I think, taught a lot of us how to be flexible to change and know that what we think we know about something could change at any time. And what we think we know about COVID-19 is changing, and the Delta variant is making us look at it differently. So that's the point of this slide, is to just really hone in that, as Wyatt said, 83% of cases in the United States are the Delta variant. And again, it's the same color that you're looking at here. I want you, for those who may be watching this from a different region of California, we really focus on California because that's where our work is centered. But this is the case on the West Coast, on the Northwest Coast. It's the case everywhere in the United States. The vast majority are Delta cases. So nobody, wherever you live, you shouldn't feel like, well, we don't have the Delta here, or the Delta is not impacting us. It is absolutely impacting the entire United States. The map here is showing you each of these pie charts. These circles are showing you data starting the 2 weeks ending July 17th. So basically the first 2 weeks of July, where were the cases and what percentage of them were Delta. So it's the majority across the United States in every region. Um, so we're answering this question directly, and then we're going to dive in deep. So, do the vaccines protect against the variants? The simple and most direct answer is yes. Yes, the vaccines protect against variants, all variants that are of concern, that have been noted right now. It's an ever-changing world we're living in. All variants that have been noted of concern right now, the vaccines protects against those variants. Um, we've looked at several studies that show that all of the vaccines in the United States. We should also know that, like, when I say we're California centric, we're also really US centric. There are other vaccines available globally that are not available in the United States. AstraZeneca may be one that you've heard of that's available globally that is not available here in the United States. So all the vaccines in the US um, have shown a phone call's coming in. Wyatt, do you want to say more about that?
Yes, of course. So yeah, all the studies that I've been looking into have been showing that every single vaccine you could get is going to protect you from COVID-19. And I think one thing that's important to focus on is the misinformation that comes out of this. Like, a lot of people are trying to combat that and say, well, that's not true. Like, why are we getting vaccines if I'm hearing all of these stories that someone got the vaccine and they still got COVID? Why would I get my vaccine if people are still getting COVID after they got their vaccine? And like Virginia pointed out earlier, some of those cases, when we really dive into them, they ended up getting COVID in between the shots, or they ended up getting it before they even had the vaccine, before they were fully vaccinated. So it's really important to know that a lot of that information that is spreading is false, and that the vaccines actually do protect you from the Delta variant. Like, 100% do help protect you from the variant. And it's the number one thing that I've talked to numerous doctors in Indian country and just in my close circle as well. And they all tell me that it's the number one thing you can do right now to protect yourself is to get the vaccine.
Thank you, Wyatt. Okay, so we're gonna bore you a little bit, but everybody in Indian country got a different vaccine. Like, some of us got Moderna, some of us got Pfizer. It really depended on where you got your vaccine or what was available to you or what made sense for you and your healthcare provider. So for the Pfizer vaccine, early research in the United Kingdom suggests that after full vaccination, so after 2 weeks post-vaccination, the Pfizer COVID-19 is 88% effective at preventing symptomatic COVID-19 virus caused by the Delta variant. The vaccine is 96% effective at preventing severe disease associated with the COVID-19 virus.
Yeah, I think it's important to highlight too that almost every one of these, either you got Pfizer, Moderna, or Johnson & Johnson, like the chance of you getting deathly sick or very, very severe sick is very, very, very low. Even with all the new variants coming out, like, sure, you may get COVID and it's possible for you to get COVID-19 again, but the chance of you getting severely sick with it is very, very low if you have a vaccine, any vaccine.
We can go to the next one. So Moderna, it is a little less effective than Pfizer at combating the Delta variant. So early research suggests in Canada, you might hear my brother's rooster crowing over there. Sorry about that. Early research suggests that Canada, after one dose, the Moderna vaccine is 72% effective at preventing symptomatic virus caused by the Delta variant. And after just one dose, 96% effective at preventing severe disease with COVID-19 virus caused by the Delta variant. There's a lot of, like, if this happens, like at one dose at this. The reason why we're showing you what the early research suggests is we're in early research. We're just a couple weeks into the Delta variant sort of taking over US cases. We'll learn more. We're showing you data from the UK. We're showing you data from Canada. We'll show you what's going on with Johnson & Johnson in the next slide. So the Johnson & Johnson vaccine is 85% effective at preventing severe disease with COVID-19 virus caused by the Delta variant, according to data released by Johnson & Johnson. So that's really the main thing here with these viruses and the Delta variant and the vaccines is the vaccines are proving extremely effective in preventing severe disease. So while it's true that some individuals may test positive for COVID-19, they may come down with what feels like a very terrible seasonal cold and flu. That they're not being hospitalized and they're not dying from COVID-19 or the Delta variant of COVID-19 is really important. That's the thing that we're really working to protect against is severe disease and hospitalization related to having COVID-19.
And I've seen a big shift in focus on like, oh, well, like which vaccine is more going to help me prevent Delta or going to prevent the future variants going on. And I think, that focus needs to shift back to just getting vaccinated. Like as long as you have a vaccine, like one of these vaccines, it's going to help you a lot in terms of your health and getting COVID-19. So I think people should worry less about which one they should get and should just try and get vaccinated as soon as they can. So this was a slide I just threw in a minute ago, and this was common questions that I was hearing from the community throughout my work week, who I'm talking with. And then I went ahead and reached out to a couple of doctors that I also work with just to kind of get their responses on some common questions that were coming in. So the first question people were asking is, one vaccine better at protecting against the variants? This is what we just covered right now. And all the doctors said that so far, all the vaccines have similar ability to protect from the variants that are coming out. And as research is showing more and more and more, as long as you have a vaccine, the chances of you getting severely sick are very low. Should I be worried about heart inflammation? I don't know if anyone else on the call has been reading about young people getting, I think it's called pericarditis after getting the vaccine. And a lot of the doctors said that the chance of these side effects is actually very, very low, extremely, extremely low. And they're only picking up news because, people are trying to find ways to kind of scare the public out of wanting to get a vaccine or wanting to do anything. So you shouldn't worry about pericarditis and you shouldn't worry about heart inflammation after getting a vaccine. The chances of that are extremely low. I had a lot of questions surrounding data and research around breastfeeding mothers or just mothers in general. And we see the same research that, it's safe to get a vaccine if you're a mother. If you're breastfeeding, it's actually could be beneficial because you're going to be, getting your child exposed to that vaccine sooner. So it's a good thing to get vaccinated if you're a mom. What should I do to protect myself against variants? Should I be worried? And then, like I had mentioned earlier, the main focus should be on just getting vaccinated. You should just try and get your vaccine because you'll have a lot less to worry about than not being vaccinated, especially with the variants going around because Delta spreads a lot quicker through people. So if you're not vaccinated, that's why we're seeing these numbers rise, is because people are not vaccinated and they're gathering now very loosely and spreading very fast. So the one thing you can do right now is get vaccinated and protect yourself. So I just wanted to kind of share these few common questions that people are asking. So hopefully if any other community members have those questions, you can go ahead and turn to them and provide them with some answers.
Again, if this information felt overwhelming or bummed you out, please know that you can connect with the Red Line. We do have groups around talking circles and monthly talking circles, so that's better or easier, more accessible to you. Again, this is an opportunity to screenshot this information, and we'll go to the next slide.
Yeah, I just want to point out too, like I was just hitting on the head about vaccines. If you need any help or any assistance finding a vaccine near you, figuring out when you can get an appointment, how to get an appointment. Maybe there's an elder who might not have the resources to do everything they need to do. Like, please give our Red Line a call and someone will be able to help them set up an appointment, get to the appointment, everything. So get your vaccine and call the Red Line.
Yes. So let's talk again, just as we close out here. How are we still combating COVID-19 and what's important? I have, and CCUIH has from the very beginning in all of this, wanted to give folks all of the information for you to make the decision that keeps you and your family and your community and your loved ones safe. And what those decisions look like, people, I think common question for me is, Virginia, are we going back into a lockdown again? Do I think we were ever in a lockdown? Not really when we compare to like how other countries globally approach COVID-19. The United States never took those same very, very strict measures. It may have felt that way. So I take issue with that in the first place. But that question of like, are we going to go back to some measures? And I don't know that it's back, but as we move forward, will new measures be put back in place again, like universal mask wearing indoors? Yes, I think likely. I think it makes sense for everybody to be wearing masks indoors at this point when you don't know the vaccination status of others in the room with you. So in your house where you clearly know who's vaccinated, who is not, that may be a little different, but in public spaces, these are just like my personal recommendations. Should we still be keeping like 6 feet of distance between your household and others? Yeah, I think you should. If that's something that's realistic and possible when you're out with your family at the grocery store or wherever you might be, the park, if it makes sense and you can keep that 6 feet of distance, I think the Delta variant is keeping us on our toes, and we should be putting those measures in place wherever we possibly can. What does that look like for a return to school in the fall? I always share with you exactly where I'm at as a mother of 4 in elementary school. Um, where our school district is slated to be back in person 5 days a week full time in just a couple of weeks. I'm really looking at what that data looks like locally. So I'm fortunate that in Sacramento County, I can look by zip code exactly to see what COVID is looking like in my zip code. And I'll have to make those choices for myself and my family about what makes sense, what risks we're willing to take, and what risks we're not willing to take. I think it's important that folks keep in mind like children's health status. If they have severe asthma, if they have pre-existing conditions that may make them more vulnerable to a severe outcome, particularly for those 12 and under, my absolute number one recommendation for anyone 12 and up is to get vaccinated. If you choose for your own set of personal reasons or your own set of health reasons, like you spoke to your provider and it doesn't make sense for you for a number of reasons to get the vaccine, then my recommendation is to continue to follow as strict COVID-19 protocol as possible to avoid transmitting COVID-19. So this physical distance, social distance is really important, particularly when we don't know vaccination status of other households. And then the next slide really summarizes sort of the gold standards of COVID-19. And there's one that we added here at the bottom that I think is really important. So be safe is this recommendation to do what you think is right. If you feel like you're not feeling well and you want to say like, oh, this is probably seasonal allergies, you know what, let's go ahead and get tested. There's community testing available in so many communities. Rapid test is available where you can get your results within 15 minutes to know if you have COVID-19. You may have asymptomatic, you may have a really light case of COVID. You might be surprised to learn you have COVID. So that's what that regular testing means. It doesn't mean that our expectation or that I'm recommending everybody get tested for COVID on a weekly basis, but we should be getting tested when our gut tells us maybe something could be off. Wearing a mask, mask wearing, that I've had some thoughts about this throughout the pandemic. Mask wearing is extremely effective when it's universal. So everybody needs to be wearing a mask. We really need to be at like 75% mask wearing threshold for masks to be really effective. That said, a mask is better than no mask. So, some people say, Virginia, I walk into the grocery store and no one's wearing a mask. So why should I even be wearing one? Is your level of protection less in a grocery store, in a room full of people where you're the only one wearing a mask? Yeah. Is your mask effectiveness decreased if the majority of people are not wearing a mask? It absolutely is. Does your mask provide some level of protection? Absolutely. Absolutely. A mask is better than no mask. So always opt for a mask when you have that available, when that makes sense for you. We're still washing our hands as frequently as possible. Hand washing is something that is really great at reducing COVID-19, the flu, even like foodborne illnesses, like washing your hands is just a really great public health practice. And then that keeping safe space, that 6 feet of distance still remains really important. there are pieces around like being in public spaces. Our hope is that those public spaces are disinfecting surfaces often. So like in the school place setting that, that there's disinfection practices happening where there's lots of touches by people and hands. I'm not necessarily saying that we need to go, that folks need to be wiping down all their groceries when they come in the home, because that just never has proven to be an effective place of transmission of COVID-19. But there are high touch surfaces that we should be making sure that we're wiping down, those hand doorknobs, those handrails, where we may have folks coming in and out of publicly shared spaces. Why, I'm going to turn to you to see if there's anything you would add on how we did. What we didn't add to this list was to get vaccinated, but we feel like we've been hitting it heavy. But please.
Yeah, I would say also alongside with washing hands is maybe carry a sanitizer bottle around. Since I've been in Sacramento, and I know this is, just in Sacramento what I'm seeing personally, but since things have loosened up, I'm seeing like common surfaces not get cleaned nearly as much. So with me, like I carry like a little sanitizer bottle, and then I always carry these little sanitizer wipes with me, like the to-go ones, because I've been realizing not a lot of people are really cleaning the surfaces or cleaning doorknobs nearly as much as when it was really, really, really like crazy where everyone was cleaning everything all the time. But I would just highly encourage to always carry sanitizer on you. And then also the testing thing is very important, because as things are loosening up and people are starting to not wear their masks and kind of be more open about being around people, you could come into contact and you might not develop symptoms for 5 days, but then you go to another event and see your cousin who is having 15 people over. And if you would have got a rapid test after that one time when you knew you were around a lot of people and could have found out like, oh, I'm developing COVID, then you would have been able to stop the spread right there. So I think it's important that if you're in really high dense areas and you feel like, man, it might be kind of risky for me to be here right now, get a rapid test. They're free. You can find one free near you, drive by super fast. So that's what I would encourage. Just kind of be cautious and constantly keep in your mind thinking about how safe is the space. And I do want to mention that CCUIH, we're going to be having an online media toolkit that'll be coming out here shortly. I don't really have a date yet, but very soon we'll have an online toolkit that will kind of have graphics that you'll be able to download and share with your communities about, what is a safe space? Like, what does that look like? How long can I be in this grocery store is safe? Or what does this area look like that's safe? So we'll have some toolkits coming with some graphics and infographics for everyone out there soon.
All right. Thank you, Wyatt. And thank you, everybody, for joining us today. If questions come up for you, if you're watching this live later, because you had something really fantastic planned this afternoon, please comment and ask us those questions. We are for always creating new content, new materials, and we want them to be community informed by questions you have, and make sure that we're answering your questions and concerns. And we don't always have the answer. Sometimes we're just waiting on the research too. So there's that. And I appreciate you, Wyatt, for joining me today and sending good vibes and energy out to all of you.
Awesome. Thank you guys so much for joining us on Sunday. And I hope everyone has a wonderful day and a wonderful start to the week. And if you have questions, feel free to reach out to either of us.
Bye.
Bye. Okay, I think